This procedure is to be used to assist a patient from lying to sitting if it is determined that a mechanical lift is not appropriate. This procedure is recommended for a patient who is cooperative and is able to assist with sitting up. This technique cannot be used with a patient who has had a recent hip replacement. One or more trained caregivers are required for this procedure. Before assisting the patient from lying to sitting, position her close to the edge of the bed and turn her on her side with her knees bent. Explain the procedure to the patient. Ask the patient to help if possible. Ensure that the bed breaks are locked. Adjust the height of the bed to the upper thigh level of the shortest caregiver. Raise the head of the bed up to approximately 45 degrees. If the patient has hip or abdominal discomfort, you may need to reduce the amount of inclination of the head of the bed. Bring the patient's legs over the edge of the bed using a front-to-back weight shift. If needed, the patient's legs can be lowered against the thigh of the caregiver to reduce stress on her hips. Raise the head of the bed as much as possible. Stand between the shoulders and hips of the patient. Place one hand on the patient's hip and the other hand behind the patient's shoulder. Stand in a side-to-side weight shift position. If the patient is able to help, instruct her to place her uppermost hand onto the bed to allow her to push against the bed during the repositioning procedure. On the designated count, perform a side-to-side weight shift while pressing down on the patient's upper hip with one hand and guiding the patient up with the other hand, which is placed behind the patient's shoulder. Once the patient is in an upright seated position, ensure that she can sit independently or she will need to be stabilized. If the bed has split side rails, the side rail at the head of the bed can be raised so that the patient can hold onto it to stabilize herself. Lower the height of the bed to allow the patient's feet to rest flat on the floor. The patient's hips should be slightly higher than her knees to make it easier for her to stand. If the patient has limited trunk strength to sit independently or assist with the movement, a second caregiver may be required to assist. This caregiver should kneel on the bed directly behind the patient and place both hands on the patient's shoulders to assist with the movement. In summary, this procedure should be used to assist a patient from lying to sitting if it is determined that a mechanical lift is not appropriate. One or two trained caregivers are required. Raise the head of the bed as much as possible and use a side-to-side weight shift when assisting the patient to a sitting position. Ask the patient to assist as much as possible.